Okay, so here we are trying to look at the blood supply of the lips and possibly also for the cheeks. Let's just do the cheeks as well in advance here. So when we look at it, it is starting from the heart there, and then from the heart there you have the arc of the aorta. So the arc of the aorta is giving off those branches. So the first one is your brachiocephalic, second one is your common carotid, and the other one is your subclavian. So the brachiocephalic branches off into a subclavian and a common carotid or a common carotid there, common carotid. So this common carotid is going to go up, and somewhere about here at the level of what? This is what? At the level of C4, it is going to bifurcate into the internal and the external carotid artery, internal and external carotid artery. So from the external carotid artery, this is where now you're going to have innervation of the face and basically the scalp. The internal carotid is going to go inside and supply usually the brain content, things inside the skull. But then the external is going, outside the skull. So a branch of the external carotid artery is going to be called the facial artery, and then once this facial artery branches off, it goes and lines itself at the mandibular angle there, if you can see, and then still down there it is going to branch off into a submental artery. And then, as we said before, when we say mental has to go with the chin, so meaning that this nerve or this artery that we're seeing is going to go and innervate the chin. Is going to go and innervate the chin. And aside that, this artery, this facial artery, goes, and then somewhere here branches off into a mesenteric artery, because there is a muscle here called the mesenteric muscle. Yeah, there's another mesenteric artery from the maxillary artery over there. So there's a muscle here that's used for chewing. There's the masseter muscle. So that's where this artery is going. This artery continues further on by separating into a superior labial branch and an inferior labial branch. Superior labial branch and inferior labial branch as a branch of the facial artery. The facial artery there continues. It gives off a transverse facial artery, and it also ends as your angular artery. Somewhere here near the eye. Yeah, angular artery. And then somewhere here gives us a lateral nasal branch and supplies there. So basically that's what that's how you're going to have. So looking at the lips, the upper lip is going to be innervated by the superior labial artery. The lower lip is going to be is going to receive blood supply from the inferior labial artery. Both of them being arteries from the facial artery. And when you look at your cheek, we need to appreciate another branch of the external carotid. So this external carotid has this occipital artery. Aside the occipital artery, it has the posterior auricular artery, and eventually we're going to have this guy inside here we are calling the maxillary artery. So the maxillary artery is going to give off a branch. One of these branches is a mesenteric artery, which is going to supply the mesenteric muscle. So the mesenteric muscle should be somewhere about here. So remember, we have the mesenteric artery from the facial artery. We also have another mesenteric artery from the maxillary artery coming to innervate this muscle that is in the middle here. And then the other one that we need to appreciate is this guy called the buccal artery. So the buccal artery is going to innervate the cheeks. Buccal artery. So on both sides. So we're only looking at it at one side, but in actual sense, it is the same analogy even on the other side. So if we were to introduce the blood vessels on the other side, you see that the same arrangement exists on the other side. So the inferior labial artery from here, anastomosis with the inferior labial artery, superior labial artery there. We're going to have the buccal artery somewhere there, buccal artery with the mesenteric artery over there. Facial artery continues into a lateral nasal artery there, ends off as your angular artery on top there, and then there is this branch, the transverse facial artery. Yeah, so you're going to have those branches there. Yeah, now let's go back to the slides.